Hello and welcome to my YouTube channel. I want to thank everyone that has subscribed and those that are planning to. Hopefully, after you listen to this, if you haven't subscribed, you will subscribe. Today, I'll be talking about a condition called fibromyalgia. I'm going to just explain this condition in a way that you'll be able to get a good grasp of what this condition is about. When you hear the word myalgia, so I've taken let's say a portion of it, myalgia, as muscle pain or muscle aches. Muscle pains, muscle aches. This condition called fibromyalgia is more common in females. We could classify fibromyalgia into two broad groups: the primary fibromyalgia, secondary fibromyalgia. Now, when we say primary, it means that the fibromyalgia is existing on its own and not associated with another condition. In other words, the only problem this patient has is a condition that can be explained by the symptoms of this condition called fibromyalgia. In the secondary classification, it is that this patient has an underlying pathology or underlying medical problem, and this medical problem could be osteoarthritis. I've done some videos on osteoarthritis, and I encourage you to watch those ones. Rheumatoid arthritis, there's also video on rheumatoid arthritis, and SLE, or systemic lupus erythematosus, or simply put, lupus. Now, what this simply means when we say secondary, it means that this patient has an underlying problem and then has fibromyalgia as an additional problem. So myalgia means muscle pains or aches, more common in females, may be primary, in other words, the only condition, or secondary, in other words, there is an underlying problem, but it's occurring in addition to the underlying problem. What are the symptoms to look out for? Number one, widespread chronic generalized pain. Now, one of the main symptoms that patients will complain about is that they have pains all over. They tell you that they have pains in all their muscles. It's important to mention that this pain we're describing must have been present for at least 3 months. So we're not talking about a week of pains, 10 days of pain. No, this patient would have had pains for at least 3 months. The pain will be widespread or generalized, occurring in upper part of the body, lower part of the body. It's widespread, and the patient typically will say, I have generalized pains. Number two, the patient will also mention that they have fatigue. And what is crucial about this fatigue is that it's really an overwhelming tiredness. Now, everybody gets tired from time to time. But what is distinct about this tiredness is that they can't explain why they are tired. Usually, if you've worked so hard during the day, you understand, you can explain. There is a logical explanation for the tiredness. But in their own case, even in the morning, they are tired. Number three, poor or difficulty with sleeping. Either they don't sleep or can't sleep properly. And what is even more distressing is the fact that when they wake up in the morning, they wake up feeling unrefreshed. Now, usually when we sleep, we wake up in the morning and we feel refreshed. We feel like people that have at least had a good night rest. But these people, despite being in bed for hours, in the morning when they wake up, they feel like they haven't slept. They feel unrefreshed. Number four, cognitive disturbances. Now, they tell you that it's as if they have brain fog. I'm sure when you wake up in the morning, when the weather looks really foggy, you can't see clearly. It's as if that's the kind of feeling they have in their brain. Poor concentration, forgetfulness. Yes, we all do forget from time to time, but this is really such that in the course of speaking to somebody, they could lose train of their thoughts, and so they have forgetfulness. Number five, somatic symptoms. Now, these are bodily manifestations. Symptoms like pins and needles, numbness. They tell you have tingling, irritable bowel syndrome, where they have abdominal pain, bloating, and sometimes it could be a situation where they have diarrhea, sometimes constipation, anxiety, depression. So they have a whole gamut of symptoms. Number six, allodynia. Allodynia is a situation where a non-painful stimulus causes a painful response or is perceived as pain. I explain that. Now, if I put pressure on my hand, I'm not expecting to feel pain because I'm only applying pressure or touch. But for a patient that has fibromyalgia, by simply putting this amount of pressure or touch, he or she will read it as pain. And then number 7, hyperalgesia. Hyperalgesia means an exaggerated response to pain. Now, if I took a needle stick and pierced myself, I should feel pain. That's natural. But in their own case, the pain that they experience is way above what the other person, I use the word in quotes, I'm sure you understand, what the person without fibromyalgia would experience. So their own response is exaggerated over and above what should naturally or normally be the case. So number 1, we've talked about widespread generalized pain. We've talked about fatigue. We've talked about poor sleep. We've talked about cognitive disturbances, somatic symptoms, allodynia, and hyperalgesia. If you have these manifestations, you most likely are dealing with fibromyalgia. I'll just say a little about this condition. It's a condition that people see you, they feel that everything is fine because you don't look ill, but in yourself, you don't feel well. And that's why there is a problem, because some people may even mistakenly say that you are malingering, you are pretending. But the truth of the matter is that you're going through a lot that people can't see, and because they can't see it, they assume you are pretending. And so it's important that I make mention the fact that no, if you're experiencing these symptoms, you are not pretending, you do have a condition called fibromyalgia. What's the exact cause? The exact cause, unfortunately, we don't know. But essentially what happens can be explained in a way that I'm sure we're going to have some understanding. Now, if you, let's say a dam, if you're going to let water out of a dam and you open just one of the gates, the amount of water that goes through will definitely not be as much as if you open 10 gates. So in these patients, the problem has to do with abnormal processing of pain. And so when one gate is supposed to be opened to bring about the response or relay the signal, so many gates are open. So there is an abnormal processing of pain such that the patient has an exaggerated response or perception of pain. What are the triggers? Number 1, the trigger could be physical or psychological or emotional. Physical or psychological or emotional. Physical pain could result from previous road traffic accident, traumatic childbirth, previous surgeries. If it's psychological, it could be in somebody that's suffering in an abusive relationship or from the death of a loved one. These are triggers that can bring up fibromyalgia. How is this condition diagnosed? Unfortunately, there is no test. There's no specific test to diagnose fibromyalgia. And again, I need to remind you that I said that there are 2 classifications. Number 1 could be classified as primary. In primary conditions, that's the only condition, so there's no test. And so when you do blood tests, they tell you that everything is normal. And so if you have these symptoms that I've mentioned so far, and your doctor keeps saying all your tests are normal, you need to consider the possibility of fibromyalgia. However, if it is a secondary type, they will be able to detect the underlying condition that might have triggered the secondary fibromyalgia. And then it's important to mention, in terms of management, that this will require a multidisciplinary approach. The condition has no cure, but there are a number of therapies that can be instituted to help. For a condition without a cure, requiring a multidisciplinary specialty, you will require a rheumatologist, physiotherapist, occupational therapist, psychologist, pain management team. And there are a number of things that can be done. Number 1, patient education. Now, understanding this condition, being aware that this condition actually even exists, knowing more about this condition is actually one of the management goals of this condition. So it's not about somebody telling you that, oh, you're just pretending. It's about knowing that a condition like this truly exists and then knowing what to do. Number 2, physiotherapy and exercise. There are certain exercises or physical therapy that the physiotherapist will institute that can help. Cognitive behavioral therapy. These are people that are specialized in talking therapy, and they'll be able to guide as to how to manage, how to think, in a bit to manage the condition. Number 4, medications, painkillers, antidepressants can be used in this condition. And so, essentially, fibromyalgia is a condition that presents with chronic widespread pain. There is no cure, but there are medications that can be used to significantly help. It could be quite challenging managing these patients, but all is not lost if you're in the right hands. Hopefully, you've learned something and you're going to subscribe. It's just going to take you, I should say, maybe less than 10 seconds to subscribe before you go. Thank you, and see you again.